everyone, welcome back. This is session 9. We'll be talking about the benefits of exercise. This segment will be divided in two parts. The first one will focus on the physical health benefits of exercise, and the second portion will focus on the mental health benefits of exercise. Please don't forget to press like and subscribe. Hi everyone, welcome back to session 9. We'll be focusing on the benefits of exercise. This will be divided in two parts. The first focus will be on the physical health benefits of exercise, and the second part will focus on the mental health benefits of exercise. There's no dispute that exercise is necessary for everyone, regardless of the health situation that they have. People with chronic pain have to be more conscious of maintaining their weight at a healthy level. The more weight gain they have, the more chronic pain they'll have. The more pain they're in, the more likely they will be to have a more sedentary lifestyle where they're not active, they're not working out, they're not exercising, which further intensifies their pain. There is absolutely no physical health condition that is made better or improved by weight gain. In fact, there are various physical health conditions that are not only exacerbated, but caused by excessive weight gain. So for example, if we have someone who has chronic knee pain, that knee pain is exacerbated by gaining weight. So the more weight gain, the more pain they have. So regardless of whether they're taking medication or not, just by the virtue of the excess weight, that pain will be exacerbated. So being conscious of that is very important. Now, prolonged inactivity. I've had a lot of patients who have chronic pain who complain of being too tired to exercise, feeling like they want to lie down on the couch for prolonged periods of time. Now, prolonged inactivity in of itself can also exacerbate pain, which we've discussed earlier, but also cause weight gain. The question here is input and output. If you're consuming more than you're outputting, which would be your exercise or your activity, you're going to gain weight. So lying around also intensifies fatigue and lethargy because you're not having any activity. So excess pain, excess weight, all work in a vicious cycle to contribute to prolonged pain. It's also fundamental that everyone develop a regimen that can be sustained and that is conducive to their life situation. So exercising 5 hours a day might not be appropriate. However, maybe 20, 30 minutes a day would be more of a realistic timeline. In the second segment, we focused on SMART goals. If you look back to the SMART goals, one of the most important facets of that was to conduct, or rather formulate goals that are realistic and conducive to your current life situation. So if you are unable to, for example, go on the elliptical for more than 25 minutes because you're going to have more pain, maybe 25 minutes is your timeline. Maybe that's what's relevant to you. Also, ascertaining what is the most targeted form of exercise. Again, as a disclaimer, consulting with your physician prior to commencing any sort of exercise program is fundamental. The last thing you want to do is exacerbate the pain that you have. You want to improve your pain. So focusing on a tailored program that's designed for your specific situation will increase the likelihood of success in achieving your goals. So if we're talking about, now that you've talked to your doctor in terms of what is appropriate for you, we're going to be talking about what are the benefits of exercise in a more general sense. So in terms of physical health, improving sleep is one thing. So the more you exercise, your stress level, which is cortisol, would be higher throughout the day and gradually work its way lower by the time that you want to go to bed. So if you had physical activity, you're able to get off the couch, you've had some sort of movement within your joints, can also help improve your sleep at night. Now, that is not to replace any medication that you're taking for sleep, but more as a complementary measure. Again, I talked about as a general sense of exercise improving mental health. General energy boost. The more you exercise, the less you're lying down on the couch, inactive, the more energy you have. Again, being conscious of your pain threshold. So if you're doing an exercise, slight amount of pain is normal if you haven't exercised for a while. However, if you notice that your pain is exacerbated to a point that you require medication, again, I would consult with your physician for further assistance. Chronic pain patients often complain of joint pain, the joints not moving well. Exercising improves movement of joints and elasticity. Also, regular exercise strengthens the muscles and improves your ability for mobility and functionality, while also preventing muscular atrophy, which is muscle loss, depreciation of muscle. So exercise also is important for people with chronic pain because often there is a complaint of inflammation. People who have chronic pain are often taking anti-inflammatory medications. Exercise is a good way within your regimen of medication in conjunction, not as a replacement, to also help decrease inflammation, improve functionality, mobility, and decreasing pain. So the more active you are more likely to maintain your weight. The more you maintain your weight, the less pain you'll have because there'll be less strain on your muscles and on your joints and your body as a whole. Exercising also increases your good cholesterol, which is your HDL cholesterol, necessary for preventing cardiovascular disease. Lack of exercise and lethargic behavior, sedentary lifestyles, significantly increase your bad cholesterol, which is your LDL, which contributes to cardiovascular disease. Regular exercise also prevents the following physical health conditions: stroke and myocardial infarction, which is basically heart attacks. So if you're improving your cholesterol levels, you prevent your chances of heart attacks. Metabolic syndrome, your sugar levels in your body are controlled more effectively with exercise. High blood pressure, type 2 diabetes, depression, anxiety, various types of cancers, arthritis, nephropathy, which is kidney disease, and of course, obesity, which is a fundamental health issue that exacerbates any existing health condition or causes any health condition. There is, again, I'm just going to emphasize this one more time. Being overweight is a huge predisposing factor with respect to health and possible contracting of illnesses. People with chronic pain should essentially focus on strengthening, stretching, and cardiovascular exercises. Cardiovascular exercises essentially would be something that gets your heart rate up to a point that you can withstand. Now, elliptical, biking, preferably not treadmill, as treadmill tends to have a lot of wear and tear, a lot of damage to the knees. So you might want to stay away from running on a treadmill. So strengthening, stretching, and cardiovascular. Excess weight exacerbates pain and inflammation and natural wear and tear. The hormone leptin is the hormone that is responsible for inflammation in the joints. So the more wear and tear, the more fatigue, less exercise, less movement or mobility, the more likelihood of muscular atrophy and increasing of the hormone leptin. Again, consulting with your doctor is fundamental prior to engaging in any kind of exercise. What we want to do is be cognizant of inactivity as well as overactivity. So the activity that you engage in must be conducive to what your threshold is in the moment. For example, yoga, Pilates, Tai Chi, cycling, walking, elliptical, swimming, strength training, weightlifting, and water aerobics are all really great examples of exercises that you could be engaging in. Just to sum up the physical health benefits that we talked about, essentially, you need to engage in some sort of regular exercise that can be maintained and sustained effectively. Again, if you're setting up a goal of running on shouldn't be running on the treadmill, but maybe possibly doing elliptical for 30 minutes a day, to start might not be realistic. Perhaps 15 minutes a day, and increasing that time by 5 minutes intervals throughout the week might be more effective. And if you are complaining of pain, again, chronic pain has all kinds of other factors that are embedded within it. However, weight gain and obesity will always exacerbate your condition. Thanks for tuning in. Please don't forget to press like and subscribe. And please come back for the second segment, which will be focusing on the mental health benefits of exercise.